Hi, welcome to Let's Get Clinical. We have this every year, and this year we're back at Bisco. Now, we have over 50 attendees, and this year's concept, our theme, is artificial intelligence. We have 2 days on AI, and it is just an amazing topic. The advances in dentistry are amazing, and we are here for it. We want to know all the cutting edge technology. We want to know how you can use it in all aspects of the dental office.
So what is a misconception of AI?
A misconception of AI is probably waiting to watch it and see what happens. I kind of look back at whether it was the digital revolution or introducing technology into your company, even go back to COVID and the way practices handled that. The ones that took that season to invest in their team, whether it was through tech, through continuing education, bettering the patient experience, when you came out of it, it didn't look like that much of a difference, but over time, that 1%, 2%, 3% really started to make a huge difference. And right now is the season to begin investing in AI. Get 1% ahead of the practices around you and what other people are doing, and watch that just compound over time to where you'll be one of the cutting edge practices using it today.
And then what is one tip that you would give somebody who's starting to use AI, especially for marketing?
Yeah, for marketing, one of the best places to get involved is with an LLM. ChatGPT is one of my favorites. It really brings consistency to the message of your practice. And so even building a custom agent that you can feed at your website and your social media and your values and all that stuff that learns your voice, and then anything you're producing, run it through that LLM, and the consistency around the values, the brand, the storytelling would just elevate your marketing to the next level.
And my question for you is, dentists who are hesitant about adding AI into their practice, why shouldn't they be hesitant? And what's the perks of bringing it into their business?
There are so many benefits to bringing in AI to a dental practice, specifically AI on their radiographs. And I think there may be some hesitancy because this isn't taking over what they're doing. We call it second opinion because it's backing up what the doctor already knows. And we really do focus on the patient education side of this. So this is going to help their patients to better comprehend what they're already showing them, because about 65% of patients don't know what the doctor's actually showing them. And it tends to increase the case acceptance by about 30% using this. And it can see 10 times more shades of gray than the human eye. So it will surface about 37% more detections for the doctor.
What is a common misconception of AI?
That AI is going to replace us as dentists, and that will never happen. It's going to assist us in becoming more efficient and better practitioners. I think it's going to improve the outcomes for our patients, but you're never going to get rid of dentists in spite of what people think.
Love that. And then what's one tip that you would give somebody starting to use AI?
I would say pick one area that you would like to see improvement. So maybe it's using it diagnostically to look at x-rays. Or maybe you need to change the way your front desk is working, so you might look at agentic AI. But pick that one thing and see if you can find the company that's going to integrate with your existing software and is going to make the transition as easy as possible for you and your staff.